Mini Module 1C, Stroke Prevention, Diagnosis, and Treatment. The goals of this mini module are for you to become familiar with strategies for preventing stroke, become familiar with procedures for diagnosing stroke, become familiar with treatment for stroke, and building an awareness of how people are affected by strokes. Prevention. When working with clients with risk factors that increase their risk for stroke, you need to have a prevention focus. In this section, we focus on prevention because it's much better to do what we can to prevent a stroke from happening. Prevention strategies involve finding ways to decrease risk, as well as seeking medical care for those other chronic healthcare conditions or symptoms that can contribute to stroke. So we're going to go over risk reduction strategies, starting with high blood pressure. Treat it. Change your habits. Eat healthy, low-sodium food, keep a healthy weight, and increase your physical activity to reduce blood pressure. If needed, take medicine as your doctor advises to control your high blood pressure. Heart disease. Manage it. Follow the heart-healthy habits listed above for high blood pressure. Take medicine as your doctor advises to prevent blood clots from forming. Blood clots can travel to the brain and cause stroke. Diabetes, or a problem with blood sugar, control it. Follow the heart-healthy habits listed above for high blood pressure. Taking insulin and other medicines as your doctor advises can delay complications, medical problems that increase the risk of stroke. And then finally, cigarette smoking. Quit. Medical treatment and smoking cessation programs can help you quit. Risk reduction strategies and medication. For people with histories of past strokes or those who are at high risk for having a stroke, a medical provider may recommend taking medicine to help prevent a stroke from occurring or reoccurring. 1 out of 4 people who recover from their first stroke will have another stroke within 5 years, which makes it vital for people to take their medicines as advised by medical providers. Community health workers are extremely helpful in supporting safe medication adherence, especially among patients with multiple doctors who may all be prescribing different medicines, sometimes without knowing what other medicine the patient is on. Community health workers can help the patient organize medicines and make sure they tell providers all the medications they're taking. Several types of medicine help prevent stroke and can be prescribed as a single medicine or as part of a multi-medication regimen. They include the following: blood pressure lowering medicines, also called antihypertensives, may be needed if blood pressure is high. Keeping blood pressure down is very important in reducing the risk of stroke. High blood pressure is a leading cause of stroke and damages the blood vessels in several ways. If blood presses against the blood vessel walls with too much force as it flows, the vessels may become damaged. Blood clots can form in the damaged areas of the blood vessel walls. Vessels that are pounded by high blood pressure over time may become thickened and lose their ability to stretch. This narrowing of the blood vessels reduces blood flow to the tissue and makes the pressure in the vessel even higher. High blood pressure can even damage blood vessel walls to the point that they burst. So high blood pressure increases the risk of both ischemic stroke by increasing the risk of blood clots and of hemorrhagic stroke by damaging the blood vessels, which can lead to rupture. That's why it's critical that people get their blood pressure under control. Another type of medication commonly given to people who've had a stroke or at very high risk are medicines to prevent a second stroke. And there are 2 types. So anticoagulants are blood thinners that help prevent the blood from clotting and from causing a stroke. Antiplatelet agents are also given. Platelets are blood cells that help the blood clot when blood vessels are injured. For instance, if you get a cut, platelets go to the area to help the blood clot so you don't keep bleeding. But people who have had a stroke are often given antiplatelet medicines to prevent the platelets from causing a clot within the blood vessels. That can then turn into a stroke. 2 other types of medication commonly given to people after they've had a stroke or when they're at high risk of stroke, cholesterol-lowering medicines. So cholesterol-lowering medicines would only be needed if the person's cholesterol is high. When you have too much cholesterol in the bloodstream, it can build up in the walls of the arteries, the blood vessels that carry blood from the heart to the rest of the body. And the arteries can become clogged and narrowed, and as a result, less blood can flow through. Cholesterol on the walls of the arteries is called plaque. And plaque also raises the risk that a blood clot will form and cause a stroke. For people who have diabetes, it's very important that they get their blood sugar or their blood glucose under control, because high levels of blood glucose over time damage the arteries and can lead to stroke. So they may be prescribed insulin by injection, or they may be prescribed pills, different types of oral medications. And people with diabetes are at higher risk for stroke than those who don't have diabetes. And that's because high levels of blood glucose over time damage the arteries and can lead to stroke in the same way that high blood pressure can with those damaged arteries. But someone who's diabetic can reduce the risk by keeping their blood pressure levels under control with medications, and in some cases also with diet and other behavior changes like exercise. So it's really important for community health workers to help your clients take their medications regularly and take them correctly, and also to facilitate communication back with the healthcare team if there's a problem with a patient being able to take their medications. One of the important things for community health workers is to explain to the clients the importance of taking medication every day, not only when the person doesn't feel well. That can be really hard for people to understand, right? So if you have a headache, you take a Tylenol. But with something like high blood pressure or a history of stroke where you need to be, let's say, on a blood thinner, you have to take that medication every single day, whether you're feeling well or not. And most patients really need a lot of help to understand the importance of this. Another role for the community health worker is to help the client disclose all medicines, herbs, or supplements that they're taking when they talk to their healthcare provider. You can help them do this by documenting with them the names of any medications, or including over-the-counter medications or any herbs or supplements that they're taking, the amount, and the schedule that they're taking them on, and write that down for the person to bring with them to the medical visit. You also want to encourage your client to share any adverse medication effects with the healthcare team right away and ask for help, because sometimes the dose may need to be changed, or they may need to be switched to a different type of medicine. And if they don't share those side effects or those problems that they're having with the healthcare team, the client may just stop taking the medicine. And the healthcare team can't do anything about the side effects if they don't know about them. You're also going to want to work with your clients to create a plan to make sure that they always have enough refills to avoid running out. You may help them set up a plan with their pharmacy or with a mail order pharmacy to make sure that their medicine is delivered before they run out. You also want to help them set up a plan to check their blood pressure often to see if the medicine is working. And that might involve even having their blood pressure checked at a pharmacy. A lot of the pharmacies have automatic blood pressure cuffs, or helping the client get an automatic blood pressure cuff to check their own blood pressure at home. And in that case, they would need to know what are the numbers that are too high that their doctor would want them to call about. And finally, you want to encourage the person to continue taking medication even when their blood pressure or clotting time is okay, because the reason it's okay is because they're on that medicine. And some clients will say, oh, okay, good, I'm healed and I don't need to continue taking this medicine. But in fact, the only reason that those things are under control is because they are on the medication. One way community health workers can support their clients is by helping them practice the type of questions that the client should ask the healthcare provider when they're at an appointment. And you might even want to practice with the client so that they're used to asking those type of questions. So here's a list of typical questions that you might want to have them practice with you. So can you tell me, what are the names of the medicines that I should be taking? How much? What amount of medicine should I take? And when should I take it? Am I supposed to take this medicine with food or in between meals or on an empty stomach? Are there certain things that I should eat or drink with the medicine or avoid eating or drinking when I'm on this medicine? What other medicine is it okay to take at the same time? And if problems happen, what number should I call? Who should I call? What should I do? And what type of problems do some people have, or what type of side effects do some people have on these medicines that I should watch out for? In this next section, we'll focus on diagnosis and treatment, as well as stroke's impact on people. So it's important to remember the warning signs of stroke, and this video will go over them with you again. Click on the video link and watch the video in YouTube, and then close that window out to come back to the PowerPoint. So keep in mind that recognizing the warning signs of a stroke is very important, because the faster someone gets treatment, the less damage they're likely to have, the less permanent effect they're likely to have.
Jenny and a grandma made on an ordinary day. There in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. Jack and his favorite friends were having lunch in town. When Hank looked up, half his face drooped down. Hank wasn't making a joke, and so Jack had to ask, what if my buddy's having a stroke? I think I better act fast. I think I better act fast. Does his face look a little bit uneven? Does one arm drift down? Is his speech coming out kind of strangely? Then it's time to call 911. Helen and Bob were walking at their favorite time of day. Helen turned to Bob and said, my arm is not okay. Her arm was limp inside her coat, and so Bob had to ask, what if Helen is having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. Stroke can happen anywhere, morning, noon, or night. And every minute after that, more brain cells die. Our heroes acted quickly, and so they all have hope. Precious time and emergency care. You can beat a stroke. You can beat a stroke. Call fast for any sign of stroke. It's what you gotta do. Call fast, call 911. The one you love is depending on you. Someone's depending on you. Someone's depending on you. Someone's depending.
Treatment can start with a call to 911. Again, the faster a person receives medical attention, the better their chances of survival from the stroke and decreased bodily damage. How is a stroke diagnosed? When the person arrives at the hospital, the doctors must decide first if they are really having a stroke or if they've really had a stroke. And so there's a number of steps that they use. First, they're going to ask questions about the person's symptoms, right? What are they feeling or what has happened? They're going to ask about the person's medical history and any family history of stroke. And then they're going to do a number of different tests to try to understand what's happening in the brain. And these tests may include blood tests. They may include a physical exam of the person and a neurological exam of the person, neurologic meaning referring to the brain, and then additional tests related to the brain that we'll talk about in just a moment. So this whole workup includes talking to the person, checking them physically, checking their blood work, and then also running these tests. So a couple of the main kinds of tests that are usually used are a CT or CAT scan and an MRI, which stands for magnetic resonance imaging. So a CAT scan is a key test for a stroke. It takes a picture of the brain, and it's usually one of the first tests given to patients who've had a stroke. It takes about 20 minutes up to an hour to complete, and the test results give doctors information about the cause of the stroke and the location and seriousness of brain injury. MRI testing is a more detailed test than a CAT scan, and it's used to find small, deep injuries in the brain. And you can see in the picture on the slide, there's that deep area of whiteness, and the MRI can pick up small areas. In addition, the person may have blood flow tests to find blockages in blood vessels. So that may involve having dye injected into their bloodstream, and the doctor's watching, often on an ultrasound of the brain or on one of these other tests, how the blood then flows through different areas of the brain to try to identify where a clot may be, or if it's a hemorrhagic stroke, to try to identify where the brain is bleeding. Again, the key to survival from a stroke and to recovery is to get medical attention as soon as possible. There's one particular medication that helps to break down clots that needs to be given very quickly after a stroke occurs in order for it to work. Stroke treatment can involve medicine to dissolve the clot, medicine to lower blood pressure. Sometimes it includes brain surgery. And then once the immediate condition is treated, oftentimes the patient will be put on medicine long-term to control the conditions that led to the stroke. So this may include treating their blood pressure, and in some cases that means taking medication for it for the rest of their life. It may include medications to help control high cholesterol levels or secondary risk factors like diabetes. And so many times people who have had a stroke end up having to go on medicine chronically, so for the rest of their lives. Community health workers play an important role in knowing how to navigate communities and how to provide clients with adequate resources. This knowledge is critical in helping the client access the resources that they need to meet their basic needs. In this case, how to get to the hospital, for instance, if they are having signs of a stroke. And then afterwards, if they are diagnosed with a stroke, how to put in place all of the resources that they need to support their recovery and their return to ordinary life afterwards. This video by Jessica Huey provides a glimpse into one woman's stroke experience and the role that fast medical treatment played in her recovery. As you're watching it, ask yourself what are some ways that a community health worker might have supported Jessica's family as they prepared for her care and for her return home. So as always with these videos, click on the link at the bottom of this slide.
It was Memorial Day 2016. I had a group of people at my house for a party, and I got a call from my mom that my sister had had a seizure. My mom and sister worked together at the time. She called 911. The ambulance came and took her to the hospital.
I was umpiring a baseball game, and I had 30 missed calls, and just not very normal.
I went to the hospital, left the party, and I get there and my sister was sitting in a hospital bed talking to me, and I was like, oh, okay, everything's all right. So went back to the room, the doctor come in, said, I think it's probably just migraines. Since she has a history of that, it's probably just a serious migraine. And so again, I was just like, okay, wonderful, it's nothing serious. Went back to the party.
Get there and talk to Jessica, and she seemed kind of fine at first, and then she was talking a little random here and there, and I was like, kind of what is going on?
As I walk in the door, I get a phone call from my dad. He said, Jessica's having a stroke. I turned right around, drove to the hospital as fast as I could, and I get there, and my sister's hysterical crying, and it was that moment that she had to decide, is she gonna take this medicine or not that might save her life or might kill her? And the doctors are like, you're already at the end of the time, you have to decide now. The whole thing was happening so fast. They're calling for the helicopter. They wheeled her out. It was the scariest moment.
Hey Jess, we're here.
We're right here, Jess.
Finally, a doctor comes in from the surgery. We made it through the first night, and they said that that was a huge sign that maybe she would live through this. Every 24 hours, they said, was more and more likely that she might make it. After we got over that, we realized what the ramifications of having a stroke would be. The first time that she got out of the bed and tried to walk, I had to leave because I didn't want my sister to see me cry.
Honestly, the next thing that I really truly remember is when the doctor came in and he was like, okay, so we're gonna try and move. And they swung my legs over to the side of the bed. And I remember thinking, well, this is weird, why are they helping me swing my legs? And then I went to stand up and I couldn't. And then he asked me to take a step and I couldn't. And that's when I was like, this is bad. Because I kept telling myself to take a step and I couldn't. Because you think that you can trick your mind and in your body into, this isn't real. This is not real. That's when it just got real.
I felt so bad for her because she was going through this for no apparent reason. I don't know. I knew we had a long way to go.
And I just remember being like, what do I need to do? Just tell me what it is. What is the next step? You need to start moving and walking. I was like, okay. And that's when I felt like I had to switch my brain into gear of all right, it's time to work.
When the PT guy came in for the first time and told Jessica that she needed to get up and try and walk, and the sooner that she tried, the more likely it would be that her body would start to heal itself. She was like, all right, let's do it. Let's get up.
During my recovery in rehab, I didn't necessarily think too much further than the next thing to do. Because there was always someone in there, whether it was a doctor, a nurse, there's always somebody telling you what the next thing is that you need to do. And I found a lot of comfort in that.
She would go to her physical therapy, and I'd push her around in her wheelchair, and she held my little baby.
I kind of told myself, you just got to get to 75% normal. If you can get to 75%, you're golden, considering everything that's happened.
Facilitate that forward. Okay, second rest.
I knew then, if we can get through this part, we can really just get through anything.
I always knew I was going to spend the rest of my life with Nick, but I didn't know what it was going to bring, especially the fact that I threw him in a hospital with me after 6 months.
Just a couple months into, I knew we were going to get married. I just knew we were.
He proposed to me in Target, every girl's favorite place.
Are you serious right now?
my God.
You couldn't have told me the day that I left rehab, the life that I have now would be what it is, in a good way. I'm married, I have 2 kids, girls. I just never would have expected that life would have turned out this way. But I wouldn't change it. I am thankful to the American Heart Association for raising awareness and letting people know what the signs are, what the symptoms are, because the more knowledge you have, the more power you have to possibly catch something before it is too late. If I've learned anything from the Go Red movement, is that I am incredibly lucky. I have met some very inspiring people. Not everybody gets to come back from what I came from. I get to do my life like nothing ever happened. That doesn't happen for everybody.
This next video, called Life After Stroke, tells you the story of Saj and gives you an opportunity to hear one man's story of survival after having had a stroke. Now, Jessica and Saj happen to be younger people, but of course, most people who have a stroke are older. So you'll hear in this video that strokes can cause a variety of different types of damage. And what type of damage a particular person has from a stroke depends on which part of the brain the injury occurs to. So different parts of the body are controlled by different parts of the brain. So if the speech part of the brain is affected by a stroke, it doesn't get the oxygen in the blood supply that it needs during a stroke, then the person's speech may be affected. If the part of the brain that affects the leg, motor functioning of the leg or sensory functioning of the leg, so feeling hot and cold, for instance, if that part of the brain is affected, then the leg is going to be affected, and it even determines which leg is going to be affected. And so people have very different types of symptoms or groups of symptoms after a stroke, depending on which part of the brain is affected. So everybody who has a stroke has damage to the brain, whether it's permanent or temporary, depends on the situation. Other types of complications of a stroke can include physical disabilities, emotional problems, including mood swings. We often don't think about emotion as being affected by the brain, but it totally is. So if the part of the brain that affects emotions or affects regulation of emotions is affected by a stroke, you may have somebody who really has a lot of mood swings or is more impulsive or more angry than they used to be. This could be caused by damage to that part of the brain. It could also be caused by the person having an emotional reaction to other disabilities caused by the stroke, right? If you were fully functioning and then you had a stroke and all of a sudden you had difficulty speaking clearly, you might get really angry or depressed about that, right? So strokes can also cause paralysis, either partial or complete, or an inability to move part of the body. They can cause memory loss. They can cause difficulty talking or difficulty understanding what people are saying to you, and they can cause behavior change. So click on this link to watch this video about Saj.
We're recording. Okay, so can you just clap?
No, I can't clap.
I'm gonna make it because I have to record it.
Oh, okay.
Okay.
Sorry, I can't.
That's okay. That's okay.
Any artist having a right side brain damage is the worst thing because it can affect your creativity as well. For me, I was affected on the left side of my body, which means the right side of my brain was affected. But lucky again, if the left side of my brain was affected, I lost my speech, memory, and function on the right side. Check my phone, message my sister as I pass my phone from my right hand to my left hand. It fell out of my left hand. I didn't realize that. As soon as that happened, my speech slurred, and then everyone around the room saw that happen. They just started freaking out, and I was like, what's going on? As soon as they started freaking out, my head started throbbing. I just laid back. Friends called 911. Paramedics showed up. I was fully conscious of this entire time. The paramedics asked me, what's going on? I'm like, I can't stand. I can't move. So they get me up to get my shoes on. I get my right foot in my shoe. I couldn't move my left leg into my shoe. So I wake up in the hospital. I'm like, I have staples in my head and my stomach. I'm like, all right, what's missing, right? I wouldn't say a dark experience, but it was more of a reality check. It kind of gave me a chance to like regroup and come back. I've lost everything, so I'm like, I'm starting from scratch. So I might as well, second time around, figure out how I want to do it right. My parents thought it would have been my darkest time, but I just got over it because you know what? It's life. That's what it was, right? What are you gonna do? It's the concept of, you know, when you trip and when you're walking, you trip and you're trying to catch your step so you don't look like you're about to like fall. That's what the situation was, right? I'm like, I've tripped. Now I just gotta get my bearings. So I'm just like doing catching all the little steps till I get my balance back. Right? That's all it was, right? I can't let it defeat me, so I gotta move forward. But I saw how restricted I was sitting in a wheelchair and how dependent I was on everyone, depending on wheelchairs or people to drive you around. I'm like, I wanted to be more independent, so I'm like, the only way to do this is get back on my feet. So I have to learn how to walk all over again. I take the bus wherever I need to go. Now I have Uber as an option if I feel like spending the money, but you know, things like that. So that's where I decided to learn how to walk again. Because the thing with strokes is people have them at different ages and they're all affected differently. What I had come to realize, and the reason for life after stroke was because a lot of young stroke survivors who've had their strokes in their teens, and then they spend most of their lives recovering up until their 30s, and they haven't got a chance to experience life like everyone else has. For me, luckily for me, I was 27 when I had my stroke. So up until 27, I did every dumb thing possible to live life, have fun, and share experiences and stories. I just enjoy playing sports. Anything I got to do, even if I sucked at it, I'll still do it. On a funny note, I enjoyed baseball, but I couldn't throw a ball for dear life. But you put me up with a bat, I can clear a ball as far as I could. In my current situation, things have changed around. So I can actually throw a ball pretty well with my working hand. I found this out at the CNE. Going to the CNE, you can't really do much if you don't have two functional hands. You only do so much. So there was this baseball game where you had to go break plates. I'm like, you know, let me go give this a try. A couple of rounds in, and about $45 in, I finally broke 2 plates in a row and won a big prize. I'm like, you know what, this is gonna be my thing. So every year since, I've been doing it, and it's gotten better and better. Yeah. It can either make you or break you, right? And I chose to let it make me. Essentially what I did was I embraced my stroke, and I figured I'm gonna turn it into something. I do whatever I need to do to make myself happy, because no one's gonna be happy for me. They say positive people don't ever have negative thoughts. They do have negative thoughts, but they have the strength to get over it. That's what it is at the end of the day, right? Anyone who's going through struggles, my thing is always stay strong and slow down. Don't make any decisions on a whim. Don't jump to conclusions. Slow down, breathe, evaluate your situation, and then move forward. Just keep moving forward. That's all you can do. If you have to ask for help, ask for help. People are willing to help. For me, when I'm at work, say my laces come undone. I can't tie myself. What am I going to do? I can take the risk and leave it untied, tuck it away, again, risk losing balance at some point. So I went and asked a coworker if they could tie my laces for me, right? It's a hard thing to do, but you got to do what you got to do, right? There's no shame in asking for your own better, right? The main message would be, you know what? Never give up. Where there is a will, there is a way. And that I'm living proof of it, right? For someone who is in a wheelchair, not able to walk, I'm walking, getting around places on my own, back to work, trying to just get back on track. life after stroke is hope. And that's what it is. Try to inspire as many people as I can.
Most people who have a stroke will need some type of rehabilitation afterwards to return either to full functioning or more commonly to become as functional as they can, even if they're not able to get back to where they were at baseline. So the types of rehabilitation that people commonly use after a stroke include physical therapy, occupational therapy, speech therapy, and emotional support. And we're going to talk about what each of these is. So physical therapy stimulates affective muscles and nerves to maintain circulation and prevent stiffness, and then guides patients through the stages of stroke recovery as they relearn basic muscle movements. So some people who have a stroke have to relearn how to walk. Sometimes they lose functioning in an arm, and they may need physical therapy to strengthen the arm muscles and the arm movements. Other people need help with balance or with being able to rise from a sitting to a standing position, for instance. Occupational therapy helps the person recover their ability to do many of their activities of daily living. So ADLs, activities of daily living, include bathing, dressing, and walking. We'll talk more about OT on the next slide, since this is a key part of stroke rehabilitation. Speech therapy helps patients regain and strengthen their ability to communicate. Some speech therapists also work with patients on swallowing if they're having trouble with that after a stroke. And finally, emotional support is really important. It may include therapy or a stroke support group, as well as informal emotional support from family and friends. So talking a little bit more about occupational therapy, the basic goal of occupational therapy is to help people regain as much function as they can. And for any given person, what occupational therapy includes depends on the extent of the stroke and the needs and goals of the client, as well as the phase of stroke recovery that they're in. So some examples we mentioned about helping them to regain as many of the activities of daily living as they can, so that they can do as much self-care as possible and become as independent as possible. In some cases, this may require adapting tasks or adapting environments, and even using adaptive equipment to maximize their ability to perform the activities of daily living safely. Occupational therapists may also address ongoing deficits such as weakness, sensory loss, or cognitive or visual impairments that limit engagement in ADLs. And they may also address other tasks that people need to be independent, such as carrying groceries, cooking a meal, managing money, or parenting. And so somebody who has a stroke, depending again on which part of the brain is affected, may have deficits in any of these areas, and an occupational therapist may work with them to try to achieve, as much functioning as they can in these areas. Another area of focus for OT is training in community reintegration. So when the person goes home, how are they going to be in their community? Do they need modifications in their home, for instance, or in their environment? They may need to learn how to use assistive technology if that's relevant, so that they can stay as independent as possible. Sometimes occupational therapists perform work-related task analysis and worksite evaluations and recommend modifications to the workplace so the person who had a stroke can return to work. That can also happen in schools, or working with the client on childcare related tasks and adaptations for safe parenting. So however that person defines their work, whether that's paid employment, whether that's going to school, whether that's parenting, the occupational therapist may work with them on issues of how to get back to doing as much of that as well as they can. Occupational therapists may also evaluate and treat swallowing difficulties as speech therapists do as well. They may help link stroke survivors up to psychosocial supports, or may even teach them practices themselves, such as relaxation techniques if appropriate. They may also teach and promote healthy lifestyle habits and routines to minimize the risk of secondary stroke. Nurses also do this. In some cases, they'll help the person develop strategies to overcome barriers to sexual intimacy with their partner if they're not able to move in the same way that they used to be able to. They may also provide help around driving, around getting back to driving safely, and possible adaptive equipment if they need that. Or if they are not able to return to driving safely, they may look at teaching them about alternative means of transportation. So you can see this is a very wide role, and OTs play a really key role in helping people kind of get back to as full a life as they are able to. As we discussed before, a past stroke increases the risk of another. And there's a lot that a person can do to try to decrease their risk of having another stroke. So they need to go on and continue to take the medications that their doctor has prescribed for them. And it may include blood pressure lowering medicine, cholesterol lowering medicine, insulin or oral diabetes medicine if they're diabetic, and then medicines to prevent blood clots, including anticoagulants and antiplatelet agents. In addition to taking medication, and again, these are mostly chronic meds, healthy lifestyle behaviors are super important. And community health workers play a crucial role in promoting prevention and decreasing ongoing risks for somebody who's already had a stroke when they share health information and engage clients in exploring lifestyle changes. Now you can identify strategies for preventing strokes, identify basic procedures for diagnosing strokes, describe some of the ways that strokes are treated, and better understand how strokes affect people. Congratulations for completing Module 1. Next module, Module 2, is about heart attacks. Don't forget to go to the Google Classroom to complete the assessment for Module 1, Stroke. This is a little post-quiz that covers all of the information from all 3 mini modules about stroke.